turn our attention to health and social protection program. Madam Presiding Officer, the general health status and well-being of any population have implications for its socio-economic development. The COVID-19 pandemic has upended the health and well-being of the global population and has clearly demonstrated this. It has also tested the resilience and exposed the fragility of the healthcare systems in all countries. Our own healthcare system was severely stretched and stressed by the pandemic. The fragility and weaknesses in our healthcare system were laid bare before us, worsened by the inept management of our predecessors. We are committed to fixing this. This administration is committed to reorganizing and transforming the institutions, systems, and processes towards building resilience and specialized capabilities into the island's healthcare delivery. Among the development measures we propose to implement in fiscal 2023 are the upgrade of primary care delivery systems throughout the island aimed at prevention and the treatment of all diseases, particularly non-communicable diseases. Aggressive and continuous public health education and promotion. Continued development of the Infectious Diseases Center at the old hospital to enhance our ability to engage in research and treatment. Full operationalization of the Roxborough Hospital to deliver all tertiary medical care services. An integrated digital data management system for the seamless sharing of information across the entire health system. This will also feed critical data and information into the island's public health observatory. Finally, an insectary food and water testing laboratory to support the surveillance of and response to vector-borne, food and waterborne diseases. Improvement of diagnostic capabilities by installing necessary imaging and laboratory equipment and training the complement of staff to facilitate quick testing and timely return of results to clients. Madam Presiding Officer, I know someone waiting 5 years now on a laboratory test result. Early detection allows for timely intervention and treatment. A structured program for continuous training and upgrading of our medical and support staff, and development of a comprehensive waste management system featuring modern green waste disposal solutions. Soon, Madam Presiding Officer, soon, very soon, Tobagonians will be sorting, we will be sorting our waste and managing our eco-footprints. Madam Presiding Officer, it is said that there is no health without mental health. The COVID-19 pandemic has highlighted the need for a more focused and robust approach to the mental health of our people, adults and children. Madam Presiding Officer, it is in this regard, in fiscal 2023, a mental health education drive will be implemented to highlight to enlighten and empower children, teens, and adults with specific and scientific facts. We will also strengthen our capacity to deliver community mental health services by expanding the human capacity infrastructure, such as halfway homes, community daycare centers, and community homes. The goal is to make mental health an easy and caring household conversation without stigma. Tobago has to get to the place that people challenged with mental health are not viewed as if someone did them something, or they did something themselves to deserve it, or it is obia or demonic possession. We must fully understand the facts surrounding mental health. And as it relates to inpatient services, we propose to increase the bed capacity to at least 8 male and 8 female, or by 33.33%, up from the current capacity of just 12 beds. Additionally, we are going to establish a dedicated child psychiatry ward with a capacity of 2 male and 2 female beds. In addition, we are going to upgrade and reopen the Tobago Rehabilitation and Empowerment Center, which was closed down, one of those that suffered the fate of Hurricane Gata, but became fully closed and converted to a COVID-19 facility during the height of the pandemic. Madam Presiding Officer, Tobago has 2 state-of-the-art hospital plans, and therefore the critical physical infrastructure to support establishment of a medical school. Our intention is, and by the way, that's one of the good sides of Gata. Our intention is to, in partnership with a consortium of international hospitals, explore the option of establishing a teaching and research hospital model on the island. This will ensure that Tobago can move to the cutting edge of teaching and learning in the medical and allied health sciences. Just like other elements of our investment program to upgrade education and healthcare capacity, the benefits of building a medical school in Tobago are substantial. For now, I only indicate that the investment will provide Tobago's providers with reliable, cost-effective, and sustained healthcare processes. These will enable our providers to achieve the goal of delivering international standard care and grow Tobago's reputation for enhanced patient outcomes. It is through advances like these that living standards will improve in Tobago and the nation by extension. Madam Presiding Officer, we recognize that there is a very strong link between health, wellness, and social protection. The island's social safety net was literally torn apart, mashed up, disseminated before the pressures of COVID-19. The demonstrated incompetence of the last administration did not help the situation. Hundreds of individuals and families were unable to receive much needed help, while some secretaries had hundreds of food cards and social emergency cards in their back pockets playing politics. Madam Presiding Officer, it is not surprising that the 2021 Auditor General report on the THA COVID-19 programs was damning. Madam Presiding Officer, as we move forward to making Tobago the greatest little island on the planet, we are committed to building resilience, efficiency, and effectiveness in our social protection program. To this end, we intend to fully digitize the social protection processes to ensure greater accessibility and more timely delivery of support to our most vulnerable. We will restructure the Social Protection Department to ensure that staff at all levels are provided with capacity building opportunities in the area of leadership, industrial relations, public service policies, performance management, report writing, and social protection department policies. We will review policies and streamline the processes of the Social Protection Department to ensure diversity, equity, and inclusion, and more importantly, that no one is left behind. We will institute a robust community engagement program across the island where staff of the Social Protection Department are available at health centers, community centers, and other community-based locations to facilitate greater access to the services of the department. which means that you no longer have to journey from country all the way to Glen Road to access these services.
Tell them. Performance, man.
We will review and streamline the processes of the social emergency card and food card unit to ensure greater public accountability.
That's right.
Because I know my Secretary of Health name not calling in no Auditor General report.
Performance.
Madam Presiding Officer,